HIV/AIDS is associated with stigma and discrimination globally, with less than 10% of people living with HIV reporting internalized stigma or experiencing stigma and discrimination in healthcare and community settings. Ewan Kagwa narrates his ordeal.
I have been on treatment for over 20 years, but the first 10 years were not easy. Once the community got to know about my status, I was stigmatized and discriminated against at school, church, even at community functions. But ever since I started treatment, my life has not been the same again. I am so grateful to government.
Kagwa says that it's everybody's responsibility to know their status and start on treatment immediately.
I was born with the virus and I never called it upon myself. And there's no single person that can accuse me of infecting them. Kind advice is let everyone know their status.
Kagwa made a humble request that whoever dies of a deadly virus be pronounced voluntarily at the funeral or the burial so that the community gets to know. Naye kulumbe tolina kyowulako message yonna gye boogerako ekwatagana ku siriimu naye nga nandisabye singa mba nfudde famire yange nga tekigikosa kugamba nti Kagwa afudde kawuka ka siriimu bakyogereko abantu bakipiikinge bamanye nti gundi afudde naye afudde siriimu abantu kyongere okubawaako ekyokuyiga abo bakyagala si kyabuwaze. Experts say that given proper training, religious leaders can become strong allies in HIV/AIDS prevention and control programs focused on awareness creation, behavior change, and the elimination of stigma and discrimination against people living with the virus. The acting Secretary General at Gaddafi National Mosque, Muhammad Ali Aluma, notes that it is important to encourage community support and solidarity using compassionate spirit.
I urge all Muslims all over the world, all our brothers and sisters all over the world, please take good care of yourself. There is no spare for life. Your life is your life and it's very precious. Take good care of your life. You will always survive in the best way possible. I thank you.
The reason as why AIDS is spreading at a higher rate, it's because of the stigma. Stigma that is discriminating people with the virus. They know they have it, and alhamdulillah there are different measures that have been put up. They're on drugs, they can't infect us when they're on drugs. But when you discriminate against them, they react negatively. Like they feel they want you also to become a victim of the situation.
HIV causes a variety of negative psychological consequences such as stress, fear, worry, anxiety, and depression, as well as social consequences. The Director of Public Health at the Ministry of Health, Dr. Daniel Chabayenzi, says stigma and discrimination are a potential barrier to HIV prevention and treatment, which results in lower rates of HIV testing and poor ART adherence. Chabayenzi notes that Ministry of Health has a non-discriminatory policy and approach for all the care they give.
We have come a long way where people used to fear because of ignorance, and we've put things in place based on the best information we have. People are being discriminated, others in fear that they will get contracting HIV just by touch and contact. But we've come a long way we've also put now workplace policies where people should be given counseling, where people can have testing facilities and care in the health facility. So HIV is just one of the things or the conditions which we should make sure people are comfortable and give their services and they live a full lifespan despite of whatever conditions they're covering. Yes, we protect everybody because now HIV/AIDS is no longer a disease we used to hide in the back. People have been able to live 30 years on treatment. We have seen people who have done virus suppression. So it's okay to declare, it's okay for HR to pick and keep that on file, but also protect your information. It's only released as you are comfortable with how much information is shared. That way we deal away with stigma. That way we see that people are championing and people are writing. One of
Zahra Abigaba, UBC News.